And we'll move on to next one. When the sparkles of joy steals the sight, how to go ahead with the firecracker injury. It's been done by Dr. Nikitha Ahamed, who has completed her DNB from Comtrust, and at present she is the faculty in the Malabar Medical College, Calicut. Over to Dr. Nikitha.
So good morning. I'll be talking about when the sparkles of joy steals your sight. So who doesn't love a spectacular fireworks? Be it Onam, Deepavali, Vishu, we all love fireworks, and we saw a very awesome fireworks last week in World Cup inauguration. But when you see a firework like this in the sky, as a doctor, mainly ophthalmologist, we would rather be thinking about injuries. And firework-related injuries can be devastating, and it can even lead to permanent vision loss, limb amputation, and in some cases, even death. And out of all firework-related injuries, globe is the second most affected organ, and it constitutes about 2% of all ocular injuries. 65% of the individuals were 18 years or younger, and 70 to 90% were male. And more than 50% of the population who had injury were bystanders rather than active igniters. And injuries were mostly caused due to malfunctioning of crackers and negligence of those igniting the firecracker. There are different types of fireworks, and homemade or illegal fireworks can have greater explosive powder and can lead to more severe injuries. And most commonly, injuries caused by firecrackers, and firecrackers mainly causes ocular burns and superficial foreign body. And there are some other type of fireworks like a mortar type and rocket type fireworks which have more explosive power and lead to more severe injuries, even rupture of the globe. Now coming on to etiology, it results in mechanical, thermal and chemical injury, and 90% of the injuries were closed globe injury and 10% were open globe, and most common ocular injuries noted were ocular burns, eyelid injuries, corneal injuries and vitreous hemorrhages. So these are the spectrum of anterior segment injuries commonly seen, which includes corneal epithelial defect, hyphema, subluxated lens, cataract, iridodialysis, and partial thickness corneal tear. And in open globe, you get full thickness corneal tear, intrastromal foreign body in anterior chamber, etc. And coming on to the injuries, in eyelid, you can see lid edema and charred eyelashes. And in the first picture, you can see there is massive facial with multiple facial abrasions and multiple foreign bodies in facial subcutaneous tissue. And in second picture in the clinical photograph, you can see superficial burns with sheathing of eyelashes and limbal ischemia in the infratemporal quadrant along with melting of cornea. This injury is a combined chemical and burn injury. And this is the most common presentation in corneal injury, in firework injury. That is, you get multiple stromal superficial foreign bodies as well as stromal foreign bodies. And this patient had multiple superficial foreign bodies in cornea, conjunctiva and even the subcutaneous tissue, and had to undergo amniotic membrane graft for non-healing corneal ulcer. And in this picture, you can see soot particles all over the cornea with a very large epithelial defect. Anterior chamber, you get traumatic hyphema, and in closed globe injury, you can get posterior synechia with a traumatic cataract. You can also see subluxation and dislocation of lens. In open globe injury, you can get corneal, full thickness corneal wound, corneoscleral wound, for which you have to undergo a primary repair. And also in second picture, you can see there is a corneal tear with iris prolapse and a flat anterior chamber. And in firework injury can even lead to an intraocular foreign body. So these are the spectrum of injuries usually you get in a firecracker injury. And now coming on to diagnosis, you have to take a complete history which includes date and time of injury, mechanism of injury, type of fireworks, and history of previous ocular surgery, presence of pre-existing defective vision in the affected eye as well as the other eye. During physical examination, you have to document the visual acuity prior to performing any dilated examination or procedure, which is very important even medico-legally. And optic nerve function is to be assessed using pupillary response and color plates. And a complete slit lamp biomicroscopic examination and fundus examination to be done in the initial visit and every follow-up visit. Also, you have to take extra care if there is a global malposition or localized area of chemosis or any disturbance in extraocular motility, because that gives you a clue for the sharpnel entry site. And if you see a low intraocular pressure, it can suggest an open globe injury, and Siddle's testing is to be done to rule out corneal and conjunctival laceration as well as to rule out open globe injury. And coming on to diagnosis, CT scan of the orbit is strongly recommended in case of projectile injuries where you suspect an intraocular foreign body, and we usually ask for thin cut session, that is 1 millimeter session, and all views like axial, coronal and parasagittal views. And it's better to avoid MRI in case of metallic foreign body, and you can do B scan or UBM in order to rule out retinal detachment, intraocular foreign body, and when there is no fundus view. Prevention is always better than cure, and for that you have to always maintain a safe distance away from firework. Try not to pick up any misfires and always wear eye protection and supervise the children. Coming on to management, you have to evaluate for other life-threatening injuries and injuries other than orbit, and you have to co-manage it appropriately with available services. And management depends on the injury that is present, and most of the patients were conservatively managed with around 10 to 12% requiring surgical intervention and 7% with residual monocular blindness. And if an open globe injury is suspected, always protect the eye with a shield to prevent further trauma and examination, and you have to use a CT scan to evaluate for intraocular foreign body. Start a systemic antibiotic, cefazolin or vancomycin. If chemical injury is suspected, pH should be evaluated, and if it's above or below 7 to 7.4, copious irrigation should be done using saline or ringer lactate, and after ruling out open globe injury, particulate matter should be manually removed. These were the surgical intervention usually performed, which includes slit tear repair, foreign body removal, pars plana vitrectomy, lens matter aspiration with IOL implantation, wound exploration and corneoscleral tear repair. And globe exploration usually done in case of suspected globe rupture, retinal detachment and penetrating trauma with possibility of intraocular foreign body. And coming on to prognosis, it mainly depends on the mechanism of injury. Mild injuries like corneal aberration, superficial foreign body has a favorable prognosis, whereas open globe injuries and patient with poor visual acuity at presentation have worse prognosis. Open globe injury can lead to permanent vision loss and even enucleation in some cases. And long-term effect of trauma include formation of traumatic cataract and angle recession glaucoma. So don't let your eyesight be gone in a flash. Thank you.
Thank you, Dr. Nikitha.